Fortunately, since that time, we've had really positive trends. So, for example, today we can report Florida that the number of COVID-positive patients that are currently hospitalized is down nearly 60% statewide from our July peak. And there are certain counties that had significant increases who were down even more than that. The number of COVID-positive patients hospitalized in the ICU is down about 52% since the July peak. The number of COVID-positive patients across all Florida hospitals represents roughly 6% of all the licensed hospital beds in the state of Florida. The number of hospital admissions for COVID yesterday, and the weekends typically see higher admissions, that was the lowest single day of admissions since the middle of June. Today, Florida is reporting about 1,950 new cases. That's the lowest number since June 14th. Antibody testing at Florida's drive-through sites has continued to register at between 20 and 25% seropositivity, while our diagnostic positive percentage has fallen to the 5 to 6% range. 27% of all hospital beds in Florida are empty, and 24% of all ICU beds are likewise empty, and ED visits for COVID-like illness have returned to levels seen during the first half of June. So those are obviously, it's been a lot of positive movement over the last 4 to 6 weeks, and we want to obviously see that continue. I want to thank Dr. Scott Atlas for coming from the White House Coronavirus Task Force. Throughout the whole pandemic, we've had the President, the Vice President, and probably just about every member of the Coronavirus Task Force has come down to Florida at one time or another, and we've gotten a lot of great assistance from the administration. And we just announced a couple days ago we're going to have over $125 million just for long-term care facilities in the state of Florida to do things like point-of-care testing, to do things like continue to fortify their PPE stockpile, to use in ways that can continue our efforts to protect the most vulnerable among us. So we really appreciate the administration for doing that, and I want to thank Dr. Atlas for coming down. We were in Tallahassee this morning. We're making a stop here, and then we'll be at the University of South Florida later today. We approached this particularly as we got into May and into June. The initial March, April was kind of everyone didn't really know what was going to happen. It was a time of great uncertainty. There were obviously measures taken in various ways across the country, including some here in Florida. But as we got through that initial period, we really took that opportunity to prepare for the future, not knowing kind of what the virus would bring. Our areas of focus were, one, protecting the most vulnerable among us, and that means, of course, those who are elderly in long-term care facilities. We've provided huge amounts of PPE to those facilities. Obviously, we've required wearing that since March. We've not allowed visitation since March, although we are going to address that very soon because that's kind of served its purpose. We do need to get that human interaction again. We've done a lot of testing, not only for residents but staff, and we test the staff biweekly. And we have over 4,000 long-term care facilities in Florida, and over 200,000 people work at those facilities. So we're doing them on a biweekly basis, 200,000, which is a lot. And then we were the first state in the country to establish COVID-only long-term care facilities, so that if you have an elderly resident of a long-term care facility who is COVID positive, you have a safe place to transfer them where they can be isolated and not risk spreading it to other members of the facility. And so that's been something. We now have 23 of those facilities across the state. But that, although that is the most vulnerable segment, are seniors in long-term care facilities, and certainly the risk to those seniors is higher than the risk to seniors who are not in long-term care facilities. There's no doubt that as people get older, the risk to COVID-19 increases. And so I think what we've seen here at the Villages is working with, obviously, the folks at the Villages, how the hospitals handled it. You have a very large senior contingent, very active community, and they made changes at the very beginning about, okay, let's dial back some of the more risky environments so they don't do the same type of indoor, large, crowded gatherings like they used to. But I think smartly from the very beginning, they have maintained a lot of activities for their residents here, particularly with respect to outdoor activities like golf. And I remember Gary Lester we were talking very early, and he's like, we're not going to be allowed to play golf. I'm like, no, you guys need to do that, because I think what they did from the beginning is they said, okay, we understand the risk. We want to take appropriate action to mitigate the risk, but we want to do that in a way that's sustainable for our residents. And so I think that they've done that, and that's a combination of the community and the individual residents really being committed to that. But I think if you look at the demographics of this community and then compare the COVID outcomes, I think that they have done far better than what I think most people would have predicted, just given the basic realities of the disease. And so my hat's off to folks throughout the villages. My hat's off to the people here at UF Health Villages Hospital, because I think it's I think it's a really, really strong story. So protecting the vulnerable has been the top priority. Second, and a close second, is making sure that we support our hospital capacity, our frontline healthcare workers, and we've done that. If you look, the state of Florida has sent tens of millions of pieces of PPE, from face masks to face shields to gloves to gowns. When the hospitals needed more remdesivir, we were able to go and work with the task force and get expedited shipments into the state of Florida. Unfortunately, our hospital traffic had picked up. We needed to expedite that. So we were able to do huge shipments of remdesivir. When there was a need for more convalescent plasma, we went out and asked for blood donations. And in our antibody sites, we encourage people, if they test positive for antibodies, to turn around and give blood. A lot of the emphasis in March was not overwhelming hospitals, and the focus was really a lot on the number of beds. I think what we found in Florida is we had enough beds. That was never going to be an issue. You were potentially going to have stresses on the staff. Part of it is just because it's a very stressful time. Part of it is because some of the staff had to isolate as the community prevalence of the disease increased. That's the staff's a reflection of society. You were going to see more and more of that. So we sent over 2,000 medical personnel across the state, many in South Florida, but also some elsewhere, to be able to buttress those efforts. And I think that that was something that was very, very important. We also, because we had these COVID-only nursing facilities, a hospital was able to take a resident of a long-term care facility who was COVID positive but medically stable and didn't need additional medical care. They had a safe place to discharge them. We would not allow hospitals to discharge COVID-positive patients back into the long-term care facilities from the beginning, because obviously that creates a hazard. But if you have this COVID-only unit where you could do that at a facility, then that's something that's obviously safe. So that was something that was important. And then when we came into June, in the middle of June, getting that third week, fourth week, you start to see the prevalence increase. There's a lot of people that were clamoring, saying, "Oh, it's going to be a surge. You got to stop elective procedures at hospitals." And I think there were some areas of the country that may have done that. I think the experience in March and April doing that showed that that's not what you wanted to do. So we did not do that in Florida. We basically told the hospitals, we said, you understand how to manage your patient load. And so if you look at like a Jackson Memorial down in Miami, they were kind of the focal point of the most intense increase in patients. So they dialed back accordingly, made sure they had enough cushion, made sure they had enough staff. And we obviously supplemented that. There were other major health systems that never had to do anything with elective surgeries or elective procedures. And that, I think, has worked so much better. These procedures matter. I mean, the amount of, and Dr. Atlas can talk about this, the amount of missed health care or people who have not gone in when they've needed to certain things is dramatic throughout the country. So we wanted to avoid that, and I think we were able to do that by allowing the elective procedures and stressing to people, if you have problems aside from COVID, this is a safe place to come. If you need to go to the ED for heart or stroke, make sure you're doing that. And then the third thing that we were focused on was just keeping society functioning. The idea that somehow you can just shut everything down, hide, and then it goes away, we know that's not how it works. It's not like a hurricane. You can hunker down, it passes, you come out. So we knew that we had to just keep society functioning. So we did that throughout June, July, and August. Last month we added 75,000 private sector jobs in the face of the height of the outbreak. In fact, I think Disney opened right as the infections had peaked, I think a few days before our ED visits peaked. But ever since they've opened, you've continued to see a downward trend, which is good. We've kept gyms, beaches, restaurants, hotels, theme parks, youth activities, sports, open and operating, and I think that that's important to do, and I think that we understand, I think, a little bit better now the importance of having society function. Part of that is having K through 12 and universities open and available for folks. And so Dr. Atlas and I are going to be going to the University of South Florida after this. Dr. Nelson and everybody at UF, I think, has done a very good job of, you're going to have 50-some thousand students return. Many, I think they're here now. How do you approach that? And I think that they've been very thoughtful about doing it. But having parents have the option to provide in-person instruction if they're K through 12, and also giving the parents who want remote learning for their child the ability to do that as well. And then certainly having the universities functioning. I mean, a university is a much lower risk environment when you have a lot of young, healthy people. When the universities closed with the start in March, at the start of the pandemic, you're taking people in a relatively low risk environment and then spreading them across the country where they're probably in higher risk environments. And so I think people have learned a lot of lessons from that. So our universities are open. They're going to continue to function. And I think that that's really, really important. So it's good to be here. We're going to hear from some folks. I'm going to introduce Dr. Nelson in a minute. And then obviously we have Dr. Atlas here as well. So thanks to the Villages for having us. We appreciate how you guys have handled this. And I think you've made a really positive difference in the lives of your residents. So Dr. Nelson?
Thank you. It's always a pleasure to welcome the governor to the Villages, especially on behalf of UF Health, and the Villages. I'm just going to provide some very brief updates. I wear two hats, or in this case, two masks today. One is I oversee the UF Health delivery system. And so there's fairly good news there. The number of COVID cases in hospitals and ICUs have been steadily decreasing over the last month. We had highs in our Jacksonville campus in the 115, 120 range. Those are now well below 100. Gainesville in the 80s and 90s, those down into the 50s. And here in Central Florida Health, the two hospitals combined, also kind of low 50s. So the health system never came close, as the governor referenced, to reaching capacity in the state of Florida. And we, I think, have the benefit of having seen those ahead of us in New York and elsewhere, learned a lot about how to manage patients. And I think you've seen fairly low death rates in Florida and good and better outpatient care. So from a health system perspective, we feel very confident we're able to continue to meet the needs of this pandemic. For the Villages themselves, it's been a fantastic partner. They have come forward with all kinds of innovative strategies to stay active and yet stay safe. We have been very anxious about this community, but they have continued to show us that they're protecting themselves. The leadership here has closed down the movie theaters and other areas at the right times based on medical advice. And so we think it's been a special partnership between UF Health and the Villages. And the last comment I'll make is the governor said, so we also have to open up today a university where over 50,000 students showed up in the last 2 weeks. So we have successfully done that. We did it, though, in a progressive series of bringing people back. Last month, we brought back, over the months of June and July, over 30,000 employees and set up ways to screen and test a large majority of those people to make sure the environment was safe. We have offered the same opportunity, 100% screening to all 50,000 students and optional testing with a very, very strict contact and tracing program set up at the university in collaboration with the Department of Health. It was a quiet weekend in Gainesville, which is always a good thing. And right now we've had, as you probably heard, very few cases, only 3 in Alachua County. So again, we think there's some really good news about the University of Florida. It's reopening, and we plan on hopefully keeping the university very active and keeping as many students face-to-face, or at least on campus, as possible. So again, thank you, Governor, for the trip back.
So good afternoon. So I'm Dr. Mike Lizardo. So I direct the University of Florida Health Screen, Test, and Protect program on campus. Since the very beginning of the pandemic, the University of Florida has been engaged in the communities where we serve. And in fact, in late March, we began our screening program here with the Villages. As Dr. Nelson said, the Villages have been a fantastic partner for us to be able to reach out to the community And much of what we learned here, we applied to the other 100,000 people that make up the UF community throughout all 67 counties in Florida. We're using that information, we're using evidence, we're using our contact tracing program that Dr. Nelson referred to gain more information, to understand more of how this pandemic is spreading throughout the community and what we can do to control it. Again, as I tell people on campus, we're not powerless in the face of this pandemic. There's a lot of information that we can use and to garner and to move forward with evidence-based recommendations. And again, focusing on the vulnerable is going to be one of those key steps. So as we learn, as we go through this and partner with everyone, we feel empowered to be able to keep moving forward. But again, there still remain a lot of unknowns, and we'll continue to address those unknowns. And every day that goes by, we learn more and more to try to apply that science to help make a difference as we move forward. So I just want to have a few brief comments here. I have very little to add to Dr. Nelson's very good summary of everything. But again, it's a pleasure to work here with the folks in the villages. And thank you very much for the opportunity for us to serve the community here.
Thank you. I'm Commissioner Richard Corcoran, Commissioner of Education. Just want to, again, give great updates. Throughout the whole month of August, we've been opening up. The governor was very clear. He wanted to give maximum flexibility to the districts. He wanted to give choice to the parents. And if whatever they chose, that form of education he wanted available to them, recognizing that the best form of education, without question, is when that teacher is standing in front of that classroom with that child and they're imparting wisdom and knowledge and the kids are interacting, is the absolute best form of education. So the results are all of our districts are open as of today. The last 18 open up today. Face-to-face instruction at all of them. Almost 60% of our parents and students chose face-to-face instruction. 95 to 100%, depending on the district, of our teachers wanted to come back and be there with their students and imparting that wisdom. Perfect example is here in the villages. We have Dr. McDaniel with us from the Village Charter School. 3,400 kids, K through 12. 77, 78% chose face-to-face. The remainder chose distance learning. And it's working. Our kids are getting a great education. Parents are being given a choice in a very thorough, safe environment. And so it's a great final day to announce 1.1 million as of today kids in face-to-face instruction of our 2.8 million children, and it's all going very well. Thank you.
Good afternoon. It's a great honor to be here representing President Trump, Vice President Pence, and the task force, and a great honor to be with Governor DeSantis. It's really quite amazing. The Villages is something, it's a huge success story, and I think it's a model for how other senior-frequented facilities are, because as the governor and everyone here knows, while the most vulnerable are those in nursing homes, there are many other seniors to take care of and protect, and this is very much in concert with the President's general strategy here on the coronavirus pandemic, which is, number one, protect the highest risk people and save lives by doing so. And number two, making sure we don't have hospital overcrowding, because as Governor DeSantis has known throughout this, you really need to make sure medical care is given to everyone else. It's not true that the only non-essential care, that's not a synonym for things that aren't important. And we know that many people, there's a considerable cost to shutting down medical care, whether it's cancer, chemotherapy, live organ donor transplants, cancer screenings, biopsies, immunizations, all kinds of things went by the wayside in the prolongation of the lockdown, and I think we've learned a tremendous amount about that. And then, of course, the third part of the President's strategy is exactly what Governor DeSantis and everyone in Florida is aware of and is doing, which is making sure that we safely open schools and the economy, because we cannot sacrifice our children. I mean, there's nothing really higher on the national agenda than educating our children, and the harms of not opening schools are really tremendous. And all that goes with the known evidence that children have very, very low risk from this illness. In fact, less than seasonal influenza. So if we proceed logically, of course, we're not going to have schools closed. We want to have schools open as much as possible, but also the President guidelines, as well as Governor DeSantis and the educational group here has said, is we want to give options to parents, because everyone has to feel safe, and there are certain high-risk families, certain high-risk teachers, certain high-risk students. So the combination of, as the goal is open in school, in-person schools, of course, the options for distance learning are very important, and I think we're seeing a great hybrid of that here in Florida. And just want to also make a remark about how Florida does represent a really great example of a partnership with the federal government and the Trump administration, as well as the private sector, in making sure that Florida gets enough personal protective equipment. Certainly cases of emergency remdesivir were helped along by the federal government here. And of course, the Trump administration has supported Floridians, the hardworking taxpayers, in their in payments, as well as small businesses here to the tune of billions of dollars. So I think it's been a great example of how to navigate through really one of the most difficult times in American history. And the governor in Florida has shown how to do it. And the Villages is an amazing place. I've never been here before, but to see the numbers, I mean, the state of Florida has the second highest percentage of people over 65. So right away, it's a huge challenge. Then we go to a place like this, and you guys have done a great job. It's quite impressive.
Any questions for either Dr. Atlas or myself?
I have a question for Dr. Atlas.
Yeah, I mean, I was shocked to see the story because they never asked me for a comment, first of all. And that's there's news, there's opinion, and then there's overt lie. And that was never a strategy that was advocated by me in the administration. The president does not have a strategy like that. I've never advocated that strategy. So that whole discussion in the Washington Post was just really sort of irresponsible to write an article like that.
I'd like to ask you about, we do have Labor Day coming up. We saw a spike after the Memorial Day weekend. We now are heading towards Labor Day. Are you concerned that people maybe feel, things are getting better? My Publix removed the one-way signs in all the aisles. So, are we concerned coming out of Labor Day that we will see another spike?
Well, we're always looking to see what happens. I mean, I think the one thing that we've shown is I think the system, we're going to be able to handle what happens going forward, and I'm confident of that. I mean, this Sunbelt spike was the most significant prevalence that the whole region has seen since the beginning of all this. But I think they've settled in. I think people have been, by and large, very, very careful. Although I would also say, people have been doing some stuff. I mean, I know with the Memorial Day, but people are they're very active now too, but I think you can be very active and just do it in a way that makes sense. And so I think a lot of Floridians have really gotten into a good groove. We're open, we have stuff going on, they understand that. Schools obviously is a big part of that, but they're doing the basic things. And so I think that if they continue to do that, that I think we should be in good shape.
I have a question for Commissioner Corcoran. Maddie with News 6 here. You had said that the reopenings are going well so far. Many epidemiologists are saying, the cycle's 2 to 3 weeks with reopening schools. We're already seeing schools in Central Florida closing down because of an increase in cases. Your reaction that in the next couple weeks you could see a spike in cases, and is it too early to say that we're doing well with reopening?
I don't think it's too early, and I think Dr. Atlas can address this also. We've only, so far, with the whole month of August, 1.1 million kids physically on campus in the K-12 setting. We had one school that we had to shut down, and Dr. Atlas will talk about this at other venues, and so does the governor. What we really have more than anything for the cause of when we see that kind of a system, because kids are very low spreaders. So you don't see that. We don't have a case in Florida yet where we've seen a child in the K-12 setting spread it to an adult. But the other way around, it's much more dangerous. And so if you have, we've sent out guidance. If you have a cold, if you have a symptom, an adult should be without excuse. All of us know when we're not feeling well. Well, if you're not feeling well, do not come to the campus. And what you're seeing initially, but we're getting, tremendous improvements every single day. We have webinars all the time. We tell our teachers, as much as you're tempted to walk down the aisles and interact with the kids, stay in front of the classroom. Because if they stay in front of the classroom and all of a sudden we get the diagnosis that they were positive, now we might only have to ask 1, 2, 3 kids that might have been in the front row, or maybe nobody, because if they're 6 feet apart, has to be dismissed, and those kids can continue to get that great learning. And so what you had in that one school that we had to close in Osceola, it was 12 teachers interacting in the break room, interacting after hours, being together, and as a result, it's very difficult. As Dr. Atlas has said, nationwide, I think the average age of a teacher over 65, it's only like 13%. In Florida, we're like 3%. So our teacher population is very young, very safe. But who's not safe is our substitutes. And so reason really we had to close is because we couldn't backfill with substitutes because our substitutes are mostly over 65 and they're just not available to us right now. So we need our adults in the school system to be very safe. But even if you look at all of this early onset, and we're making great strides in protecting the student body and the whole education community, dismissals of kids having or adults having to leave the school system, it's like less than 0.5%. I mean, and so all of, the 99.999% of kids can still go and get that great education, and all those other things that Dr. Alice talked about and the governor talked about. We don't have to worry about food insecurity for these kids. We don't have to worry about there being an achievement gap. We don't have to worry about a decline in child abuse cases. We don't have to worry about drug overdoses and all of those other things, far more severe, far more dramatic, and far more certain than any low risk to COVID. So I think we're making fantastic strides. I don't know if you want to add anything to Dr. Alice.
I think it's also just important to point out when you hear things about cases. There was a Cherokee County, Georgia, was like there's some cases, and then they quarantined like everyone who had been in the hallway. But it's just like 1,000 people, quote, exposed. And then you don't ever hear anything about that. So what I would tell us is, okay, if there is 3 cases in a school somewhere, how many of those people actually developed any type of symptoms? How many of them were ill? You see a lot of things on college campuses, like University of Alabama had all these, quote, cases. I don't think a single one of them required hospitalization. And so that is important, because to say that if there's a case or 2, that all of a sudden that means the world's ending, a lot of times those are folks who are either asymptomatic or minimally symptomatic. And the second thing I'd say is, and I think that I'll let Dr. Atlas follow on this, is if you have somebody who is, we've kind of come full circle. When we started this, like if you're sick, stay home. That really is the most important thing. We have all these things, all these different measures and stuff, which is fine. But at the end of the day, if people are symptomatic and they stay home, that is going to solve so much of it. And so we're really stressing that for teachers as well as for students. The good thing about students is you have online now. So if you're sick, you're not going to fall behind because you have the option to go and do that and keep up. But I think that focusing on those symptomatic, somebody's symptomatic, they shouldn't go to school. If they do go to school, they should be sent home as a student. But then the other students, just because you were in the hallway with somebody, you should not have to quarantine. Quarantining healthy people, I think, is a big problem. And I mean, I don't know, like when I was in, Dr. House, I was talking about, like, we had a 5-minute break in between classes, I think, and when I was going to school. So it's like you need 15 minutes of close exposure before you would even do that. So I think focusing on that, doing more surgical, I think is really the way to go. But I'll let Dr. Atlas follow.
Yeah, thanks, Governor. A couple of clarifications about the age thing. It turns out that in K through 12 schools, half the teachers are under 41. And 92% are under 60. So, I mean, it's not a high-risk age group, although there are high-risk teachers, clearly. And for those teachers and for those high-risk students, of course, it's very important to use all the mitigation measures and protect them. But for very low-risk students who are virtually zero risk of death, not zero, and very, very low risk of hospitalization, much less than seasonal influenza. In fact, the JAMA Pediatrics article, a journal that studied 46 pediatric hospitals in North America, their bottom line was, quote, you have a far greater chance of getting a critical illness from influenza than from COVID-19 for children, unquote. And what that means is if you're talking about closing schools for the children during this, then you must necessarily close schools from November through April during flu season. Of course, we don't talk about that, because that's really not rational policy, even though we have 35, 60, 90,000 people in the United States die from influenza, and 70% of them are those same high-risk elderly people. So we have to look at the data and understand that the schools are a very low-risk environment. When you look at the contact tracing studies that have somehow been ignored in the United States, they've been done several places in our peer nations in other countries, and for instance in Switzerland, 0.3% of cases originated in the schools. By the way, that includes the originators being teachers, 0.3%. And other studies have validated this. So children are very, very low risk. We know how to protect the high-risk people. It's very harmful to have schools closed. And so when you start introducing closure of schools because people have positive asymptomatic tests, that's sort of not the purpose of testing. The purpose of testing, like everything else we're doing here, is to stop people from dying, stop people from getting a serious illness from this disease, and allowing other people who are very low risk to function. And that's what the new CDC guideline came out this week on testing, and I'm very much for that, as was every single doctor on the task force, despite what you may read, is that we do testing in a very smart way. The administration, the Trump administration, and particularly hats off to Admiral Giroir of the task force, who was the shepherder of this entire testing regime. We have a massive testing apparatus now. And what we're doing is leveraging that into a very smart, targeted strategy to make sure that we're using testing for actionable items. That means if you have a test, what are you going to do about it? And what we're doing here, and the guideline articulates this very clearly, is that we're focusing and ramping up testing where it counts. And that means saving more lives, particularly, specifically high-risk people who we know it's a very challenging environment. Even though the Villages has done an awesome job, the goal is to get 0 people to actually die from this. And so there's a lot of new nuances to how to do that, and this is a big focus of the Trump administration now.
On that, do you think it's too soon with schools opening up just within the last week or two here in the state? Many of them today, many last week. Do you think it's too early to say that there isn't child to teacher or child to adult transmission?
No, the issue is not, is there child to adult transmission? That's sort of icing on the cake. There's a less risk of child to adult than adult to child. But the things you have to remember are, the answer is no, it's not too early, but I'm going to explain why. The things you have to remember are that children have no serious risk from this disease. It's very safe for them. They can handle this. And many of them, most of them, in fact, the majority of them are asymptomatic, even if they test positive. That's point number one. Point number two, we can never underemphasize that when you close schools to in-person learning, it is enormously destructive. Not just the fact that reading skills go down 30%, math skills go down 50%. Distance learning alone is a failure. Okay, so it's not the same thing, by the way, for people who are lower income and middle income. This is a huge problem for those families. It's somebody who has a second home in the Hamptons or something, okay, they're going to buy a bunch of iPads. That's not what real life is for people with distance learning. And someone alluded up here to these other things like the health risks to children. That's where we discover vision or hearing needs. That's where child abuse is reported. That's the #1 agency where child abuse is reported. So it's an estimated 215,000 cases of child abuse were never visible and never reported just during the first 2 months of the lockdown. These are serious, enormous problems with not having in-person schools. Remember, the children are not at significant risk here. We just need to focus, and it's not a minimal thing, of course it's very challenging, on protecting people in these multi-generational homes, in the communities, the high-risk teachers. And again, I think the governor has the same policy that the president has recommended and supported, which is that if there are high-risk teachers who feel that they are not able to socially distance and use whatever protective equipment they can, if they are still uncomfortable, they can teach from home. That doesn't mean the school closes. We have to focus on the children. I would make one last statement, and that is that we are the only nation among our peer nations that are hysterical about opening schools. When you look at the rest of our peer nations, and we're talking about Canada, the UK, Switzerland, Sweden, the Netherlands, Denmark, Germany, Finland, Italy, Spain, every single country, they're opening schools because they recognize the data. And the data is that children do not have a significant risk from this disease, and they do recognize the enormous harms from closing the schools. We're the only country that seems to be willing to sacrifice our children out of our own fear, and I just can't accept that.
Governor, could you address, we're currently hovering in this economic opening in the state that some people are saying, when are we going to open bars again? Movie theaters have been opening in recent weeks. That may lead to more cases in the fall. If we get into a situation where we're seeing that, is it possible that the phase we're in now is going to be the phase we're in next spring, next summer?
Oh, no. Look, I think what we've shown throughout all this, remember, you go back to the end of June, beginning of July, people said, you have to shut down Florida. It'll be exponential. It'll run away. It'll never go down unless you shut down. And, I looked at kind of the life cycle of the virus in different parts of the world, different regions of the United States, and I said, no, if we focus on protecting those most vulnerable, if the folks, particularly in the nursing homes, if other folks take the basic precautions that we've preached about avoiding some of the riskier behaviors, and then if we make sure those hospitals have what they need, PPE, personnel, whatever, medicine, that we would be able to get through it, minimizing the harm to society. And so you've seen theme parks open. We had the theme park roundtable last week, and you asked Universal and Disney and SeaWorld, how are you guys doing in California? Oh, what? They have no pathway to get back, in California. And so we had a different approach, and so I think that's been good. Now, you're right. If you go in Central Florida, everything's open except the nightclubs and the pubs, and so that's something we're going to address. It was a situation where we wanted restaurants, we had them doing some certain things. So we said, look, if a pub does the same thing, what's the problem? That wasn't their business model, and so we ended up it was an enforcement issue more than anything. But we are going to address that. We're going to move with that, and then obviously we're going to work on our 3 southern Florida counties, getting them where we are and there. But that's really the last piece of the puzzle. And I think that's something that's good. We gained jobs, 74,000, I think, private sector jobs in July. And just imagine if we had shut down the state, we'd have lost another 300,000 or 400,000 jobs. And so I think that we understand what we need to do, but we will never do any of these lockdowns again. And I hear people say they'll shut down the country, and honestly, I cringe because we know places that have done that. The most draconian lockdown in the world has been Peru, military enforced since March. They have the highest per capita mortality in the world from COVID. And at best, what a lockdown will do is delay. It does not reduce the ultimate mortality, but I think Dr. Alice would agree, it creates a lot of other problems with mortality that a lot of people don't necessarily focus on. And so one of the things I've tried to stress in the last couple weeks in particular is, COVID's important, but if you look, we have about 6% of our beds are filled with COVID-positive patients. All those individuals we care about, their families, everything, and we need to be there for them. But out of 22 million people, we've got issues with people delaying cancer screenings, not coming in for heart or stroke. We have, we've lost ground on the opioids since March, some of the other mental health issues. So we want to continue doing all of that. I think that's got to be a full spectrum approach. But I think having that kind of full spectrum is really the way to go. So we're going to get there where everything's good. It's kind of like this isn't easy to do, partially because this has become very, there's just a lot of fear out there. We've tried to allay those fears with the schools and some of these other things, but that'll be big to make sure that that the parents have that option everywhere in the state, and we're getting close to that. We've got a couple more counties, a few more counties that we'll bring on. But Dr. Alice, did you want to talk about maybe just some of the negatives that you've seen in terms of some of these lockdowns?
Sure. So, this has been reviewed before, but the most recent thing that came out, I think is very important because it has to do with the college-age population. The CDC outlined that in the month of June, ages 18 to 24, 25% of our children, my children are that age, 25% of people in that age group had serious thoughts of committing suicide. This is a lockdown issue. And so we really have to be very careful. There are 650,000 Americans who have cancer, who are on chemotherapy. And during the first 2 months of the lockdown, half of them didn't come in for their chemotherapy. I mean, you had thousands of tumors that were not biopsied, that were known tumors. We had 2/3 of cancer screenings that were not done. We had more than half of childhood immunizations not done. 85% of living organ transplant surgeries were not done. And so a lot of this, part of it was due to the intentional exclusion of medical care. which we really did very well as a nation. I mean, there were isolated hospitals that were overcrowded, but the overwhelming majority did not have overcrowding. There was not a single person in the United States, by the way, that needed a ventilator that didn't get a ventilator. But, you know, these harms from the lack of medical care were mainly due to fear instilled in patients. These were patients who had brain lesions, brain abnormalities that could rupture and cause paralysis or death, and my neurosurgery friends at Stanford were calling the patients personally, and 40% of them weren't coming in because they were afraid. So I think, you know, we have to understand, the public has to understand that you're in good hands here in Florida, and you're in good hands in the national leadership as well. We know what's going on. This is not March or April. We've had a massive decrease in the case fatality rate since then. We know a lot more. We have the length of stays in hospitals are 1/3 what they were at the peak, 50% less mortality if you are hospitalized. Far less people need an ICU if you're hospitalized. Far less people need a ventilator if you go into an ICU. And the age of people who are getting these cases is possibly 20-plus years, on average younger than the high-risk elderly who got it back in March and April. So we're doing much better. We're doing much better at protecting the elderly. We're not perfect, and I think it's very important that we are very diligent with that population. And we are advocating and changing, adding even extra protection. I mean, the administration is not just adding point-of-care testing, for instance, to every single certified nursing home in the country. That means rapid turnaround tests. We're also adding infection control help by hospitals, partnering with nursing homes. We're adding point-of-care testing to senior centers and places where people are ambulatory and not necessarily living inside a nursing home. There's a big effort being made to ramp up our protection on the elderly, because the point of all these things are to save lives, not to document asymptomatic people who are low risk.